Go right ahead whenever you're ready.
All right, thank you. Thank you all for joining me today. My name is Rachel Hatton. I'm the Executive Director of the South Carolina Respite Coalition. I just wanted to talk to you today about family caregiving and respite and let you know that it's okay to take a break. So I wanted to sort of lay the groundwork for what we're discussing. So before we can talk about respite at all, we have to talk about the state of caregiving. So family caregivers are the largest provider of long-term care in the United States. Nearly 1 in 4 adults in South Carolina identify as a caregiver, and an additional 1 in 6 expect to become a caregiver within the next 2 years. And most women, or most of the caregivers in South Carolina are women at 58%, and include parents, spouses, adult children, children-in-law, siblings, and partners. So you can see they have a variety of relationships to the care receiver. And my agency, it's about 88% women that we serve. So what are the costs of caregiving? South Carolina caregivers provide almost 610 million hours of unpaid care at an estimated economic value to South Carolina of over $7.6 billion annually. And so that's typically calculated by if a care receiver had to be institutionalized, the cost to the state would be that amount, or if you had to pay market rate for caregivers, that would be the cost. So that's generally the two different calculations that are used when we see amounts like that, placing dollar value on caregiving services. And South Carolina caregivers spend over $7,400 of their own money each year in caregiving costs. And that can be through spending direct funds for supplies and medical supplies needed, travel expenses, and then also through, they have costs associated with losing productivity or hours at work, losing income through having to take unpaid leaves, and oftentimes having to leave the workforce entirely to ensure they have time to provide care for their loved ones. And then also caregiving is extremely stressful, so it can oftentimes create chronic care conditions in family caregivers, which have an associated cost through medical care to them, and long-term costs, and the having fewer contributions to retirement accounts and things of that nature. So now we'll talk about my agency. So the South Carolina Respite Coalition is designed as an agency to expand quality respite opportunities in South Carolina throughout the lifespan for South Carolina families who have a member with special needs. And so our goals are to educate the general public and specific groups about the need for respite care, develop strategies to provide and improve respite services for families, and provide support for families and professional care providers through coordinated information services and resources. So we have to also have an agreement on what we mean by respite. So respite is a break for family caregivers, parents of children with special needs, and others whose loved ones are dependent for care. Respite is short-term, temporary breaks, and it's not to be confused with a daycare so that we can go to work. And so, typically, in definitions of respite, we have to create a delineation between going to work is not respite. It's a getaway, of course. It relieves you from providing unpaid care to a loved one, but it's not truly a time for you to rest, recover, and rejuvenate, which is what we consider true respite. And so we want a system where families are able to have true respite and time to do things that they want to do while their loved one is staying with someone else safely and receiving quality care. And it's time for families to spend with perhaps other children who don't have disabilities, to go out and engage in other activities and spend a long time with them, get a good night's rest, take a nap, going away for a vacation. And so when we talk about respite, we want to make sure that we're including that it is purposeful and meaningful. to the care receiver and the caregiver. So there's two main types we organize respite discussions into two main types. We talk about formal respite, and then we talk about informal respite. And so formal respite is provided by paid and trained healthcare providers. And it involves typically a longer duration while the caregiver has a break. So it can be going to a care facility for a few days, going to a day health facility, or it can be with an in-home provider that a family selects and hires independently. And our agency can help coach families on what that process looks like. And then informal respite is provided by a caregiver's circles of support or through alternative activities for self-care, maybe going to an in-home yoga class while your care receiver is doing something else that doesn't require you to be there with them, or intermittent care breaks throughout the day to relieve from duty. So it could be as simple as, I have 20 free minutes. I am going to sit and stare at the wall and just think about things and just rest. It can be that simple. And so we also coach families on looking for ways to add those care breaks, short and intermittent, throughout their day, so that they aren't constantly providing care. And so a lot of caregivers at this point, they'll hear, oh, that sounds great, I would love a break. How do I pay for it? And that sounds expensive. So in a lot of ways, there are supports to accommodate at least some respite, although unfortunately the paid systems are never enough to support all the respite needs that family caregivers have. And so one way to pay for it, of course, is self-pay through through hiring and selecting perhaps a neighbor or someone in your circles of support. Families who are eligible for Medicaid waivers for their care receivers can be authorized for respite services that way. There's some limited access from Medicare. Also, the National Family Caregiver Support Program provides for respite vouchers to seniors. Veterans and military families can receive respite supports. And then there's some long-term care policies and insurance policies that will provide for respite care. And then there's other voucher programs. So there's a voucher program for Alzheimer's, and then my agency also runs a voucher program. And so families who are eligible can receive a certain amount that can be used to purchase respite care. And then part of that typically is also educating on ways to increase their circles of support so that they can sustain respite as a habit after they've expended all of their voucher funds. So circles of support, we always want to encourage people to widen them as much as possible. So think about everyone you might know and who loves your family and who's already involved with your care receiver, and start building back those circles of support. We know it's really easy to become isolated as a caregiver because the task demands are so high. So places that we encourage you to think about and relationships that you might have that you can re-engage with are through your place of worship, your extended family, your neighbors, any social networks that you've ever participated in, and then other family caregivers. And you might be able to meet people through support groups or other people who perhaps have children with the same care condition. And we've seen people form co-ops that way. Also, you might have people that you work with who are willing to provide informal supports for you. And then one of the biggest ways for families of children with disabilities to find respite care providers is they often forget that their child is often involved with a lot of professionals who may be social workers or physical therapists or teaching assistants or people in extracurricular activities that your child's associated with, who might be able to help identify other sources of providers. So never forget about tapping into your network through school to see who's available to provide supports. And so another thing that we relatively often see is that caregivers wait until it's at a point of crisis before they start receiving any sort of support. And so, you know, there's also a lot of fear and shame around using respite or asking people to help. And, you know, maybe you feel like your house isn't clean enough, or you should be able to do everything yourself. And, you know, you really think about how oftentimes we get a lot of joy from helping others and sending others support. And we want to also give people the joy of helping our families. And so maybe think about it not so much as, you know, we're asking a lot of other people, but think about it as, you know, we're including others in our family life in a way that they might find also meaningful and purposeful. And give up on your ideas of perfectionism. You don't have to have a perfect house or a perfect family or the perfect time to start including respite in your life. And studies show that family caregivers need 4 hours a week of respite to get maximum benefits from a break. And so we recommend building as a habit, starting small and early in your child's life or the life of your loved one, so that you can sort of build good relationships and that your care receiver can build good relationships with the people that are providing respite for them. So it's also a way for them to build relationships and develop new skills and have a break from you, because that's often important too. So respite is really something that's for the whole family. It's not just for the caregiver. It really, you know, it really includes you in a larger community. I mentioned some of the barriers for caregivers receiving access to respite already. So the idea of setting up respite can be overwhelming if you are already overloaded with tasks and the difficulties of providing care nonstop. And then many caregivers, because of that, wait for respite until there's a crisis, like somebody has to have a surgery, or you have to go to a funeral out of state, or someone else needs your care in another area. And so we really feel like it's important for families to think about who can help before it gets to that point, so that they're not scrambling to find supports when they're really at the point where they have to have immediate care. And then because of task demands, many caregivers don't use respite for truly restorative activities. So they're using it to run errands or to provide care for someone else, but they're not actually able to use it solely for time for them to engage in things that mean something to them and give them a high quality of life. And then also there's often feelings of guilt, or that other people won't be able to care for their loved one as well as they do. And there's some ways around that. First of all is training. And I know that a lot of family caregivers find that it's difficult to recruit and hire respite care providers who are already trained. And so it really becomes incumbent on them to train them as far as what their care receiver needs specific to their family. And that takes a lot of time, and you need to make sure that families that you work with, or if you're a family caregiver, that you're able to think about all the sort of skills and qualities you'd need in a care provider when you bring them on board. And then one of the things that we see most commonly is that family caregivers don't think of themselves in that term. They don't think of themselves as a family caregiver. They think of themselves as, I am so-and-so's sister and I helped them. And then, you know, we'll ask probing questions like, how many hours a day do you provide care for your loved one? And how many activities of daily living are you helping them with? And do they live in the home with you and as a constant care? So we start asking these other questions about their role in their family, and then the actual duties they're performing as a caregiver. And that's how they start to make that connection. Like, I'm a family caregiver, and this is, creating stress for me, even though providing care also brings a lot of joy, it brings a lot of demands. And so we want to make sure that we're helping family caregivers understand that there are supports available for them, and that they have access to them, and try to create that access. And speaking of access, that brings us to geography as a major barrier. South Carolina is largely a rural state, and we know that it is oftentimes very difficult for family caregivers in rural areas to find day programs or to find other care providers who can come into their home, especially through formal respite activities. And so that's why we have to encourage them and work with them to build circles of support, and also work with care providers to try to do workforce development so that families can access respite care. Another barrier that we see often is that families have a care receiver that has a lot of severe and complex medical conditions. And so they might require additional training and supports of healthcare providers, and might need more supports and have more demands than some other families. So that might make it more difficult for them to find a provider who's trained and capable of providing care. And then simply, a lot of families don't know that respite is even an option for them. And so we have to do a lot of awareness raising and information provision for them to understand that and know how to even begin to get it. But what we find is that it's typically a combination of those barriers. It's usually not one thing or the other. It's a lot of those come together to make it difficult for family caregivers. And what we know in South Carolina, there's 770,000 caregivers. 1 out of every 4 adults is a family caregiver. And the number of people who are actually accessing respite services is so much fewer than that. And so we also have to think as a system, how can we start providing these supports on a more wide-scale effort to support family caregivers, since 40% of caregivers die before their care receiver. One of the ways that we address this is through the voucher program at our agency. The focus of this is caregiver relief. So the Respite Coalition awards vouchers in the amount of $500 to eligible family caregivers, and they can be used for formal respite, and we work with each approved family to help them find the best option for their situation. And if they need coaching on how to select and hire a provider, we can coach them through that process so that they can make the transition to being a household employer of a respite care provider. And so the vouchers are only used for breaks from hands-on caregiving. We have a lot of families who ask us about, can they use it to supplement care or pay for care that they would already be receiving, pay for medical bills or purchase supplies, pay for care respite that they'd already received, or use it while they go to work. And because our focus is on true respite, we don't allow our voucher to be used for any of those purposes. And to apply, we currently have a waiting list, and applications are 4 pages, and we focus on family caregivers of care receivers who are ages 59 and under, because we have a partnership with the Aging and Disability Resource Centers, which you often know as their area agencies on aging. And they provide state funding for the Family Caregiver Support Program for family care receivers who are ages 60 and over. And so we fill the gaps in service. So if for some reason they're not eligible at a AAA, we might be able to serve them at our agency as well. And the application is 4 pages and includes a medical attestation of need as well as a caregiver survey. So we can look at the stressors before and then after to see if respite was of use to them in helping reduce stresses. And then the authorization period for the vouchers are typically 3 months, and that can be extended. And we often extend vouchers. And the reason we do that is for families who are using respite for the first time. There's a lot of coaching and education on how to use it and when, and helping them figure out how to start scheduling that when, you know, they've so often just been on autopilot or working so hard. It's really takes them some time to start scheduling it for themselves and building it as a habit. And so sometimes, even though $500 doesn't go very far, sometimes it takes families a while to even be able to use it. And eligible family caregivers might be able to receive up to 2 of these vouchers in a year as funds are available. And if they select and hire a respite care provider independently and become a household employer, they pay for the service up front and then submit timesheets to us for reimbursement. And then that's signed by the family caregiver and the respite care provider. And so it'll include things on there about what families did with their respite time and what kind of break they took and what activities they participated in. And that's really meaningful for us as an agency to be able to touch the work in that way and see how it impacts their lives. So last year, the fiscal year that ended on June 30th, this is what our units of service looked like. We served 575 caregivers through the voucher program, and that ended up being a little over 32,000 hours of respite hours that were funded in 37 of 46 counties in South Carolina. And so we identified the counties where no vouchers were received, and we'll be targeting them throughout this fiscal year and strategically over the next several years. And what we find is, of course, that most of them are in the PD region of South Carolina. And the PD is a historically underserved area, and we're really focusing on efforts to make sure there's increased access in those areas, even though they're rural, and reaching those families and seeing what their needs are. And so we would welcome anyone from that area who's interested in respite. We just started a Respite Advisory Council in that area that brings together service providers, family caregivers, and interested parties to help us with outreach strategy and, lessening the barriers to access. So last year, our average caregiver age was 47, and it ranged from ages 21 to 87. And then for care receivers, the average age was 18. But that ranged from 1 year old all the way up to 90. So we do serve across the lifespan, and that's really important for us as the only agency in South Carolina that really focuses on respite across the lifespan, regardless of age or care receiver care condition, because we focus on the needs of caregivers, which regardless of specific care conditions, caregiving, the emotional and physical aspects of it are often the same. They're experiencing the same difficulties. So what are some of the things that people put on those timesheets for what they use their respite for? A lot of families who have the means go on vacation. One family visited a college, went on college tours with their older child, and one mom walked around Target leisurely with coffee. And this was all pre-COVID-19. Oftentimes they take a nap in another room while they have a respite care provider there. Some families went on dates with their spouses. They were able to go to lunch. I had one family caregiver that I loved seeing her timesheets come in because she would go to Charlotte to go visit a friend up there and stay the night. And a lot of them used it to go to gym and medical appointments and focus on their own health and needs. And then one family caregiver said that she just sat quietly and breathed. Every year, we produce a document that is called Faces of Respite. And so these are outtakes from our Faces of Respite last year. And I'll give you just a moment to briefly read through this story. And so these are all pictures and stories of families that we worked with in the voucher program and their experiences on using respite to increase their quality of life. And they have children and family members of all ages. And one of the other things that we really care about and that we really enjoy doing every year is respite camps. And so there's a number of camps that we work with in South Carolina that serve people with disabilities. And we provide vouchers to attend the camp for the care receiver because it is oftentimes the only time during the year that a caregiver has a whole week where their child or loved one is away from home and they get to have a long duration of a break just for themselves. And this is a handwritten thank you card from a 32-year-old care receiver that was able to go to Camp Spearhead because of our voucher program. And one of the things that was really sad to us this year is that all of the camps that we serve had to close because of COVID-19. So we hope that in the future there'll be a way for them to safely reopen because it's one of those meaningful and purposeful activities that's meaningful and important to the care receiver. They look forward to it all year, just as the family caregiver does. So what are some of the things that we've identified as challenges and successes through our voucher program and serving family caregivers? And one of it is that coaching is essential. We cannot provide this program without coaching families on how to access respite and how to use the voucher, because so many of them have never had a chance to have a true respite break before. And oftentimes the reason for that is because there's a lot of realities in our state about family caregivers' economic status, where they're located, and what resources are available to them. Most families don't have the economic security to be able to go on vacation with their respite. And so, what other ways can they find time to do things that are important to them, that meet their needs, but are also within the scope of what they have available to them? And then part of that also means that we have to be referral agents to a lot of other resources for families to meet their basic needs. And we also have to keep in mind that respite is something that is not nice. It is something that is necessary for families to be able to continue to function successfully so that they can access other services and continue to work. Everyone deserves a break, and no one should be required to work constantly, even if it's providing care for someone they love. So respite is one way families can be successful. We also have to educate referral agents on eligibility and our requirements and what respite is, so that we can make sure we're getting appropriate referrals so that people aren't frustrated when they come to us and we can't buy durable medical equipment for them and things like that. And oftentimes what we find is the need for the service exceeds the availability for the service. And so, there's 770,000 caregivers in South Carolina. Not nearly all of them are receiving respite either through us or through all of the other sources in the system. And so it's also part of what we do is work to develop and enhance the whole system of care to recognize what respite is and how to support it. And what does that mean for you as a viewer of this training today? How can you help? And so we ask that everyone we come in contact with become a respite advocate and a respite champion. And so that means that you have to learn how to have the respite conversation. What is the respite conversation? It is when you know that, one of the 4 people that you know is a caregiver, you ask them about how they're doing, and that your relationship with them becomes transformative and not transactional. And so you think about, what is going on that they need, and are they able to participate in events and things like that, and what do they need to support that, and encourage them to participate in community events that they feel safe to do so, and preserve relationships. And so that means that you promote informal respite, but you also volunteer to provide respite if it's possible for you. And you be someone's circle of support and maintain relationships with them, and that you listen to their stressors and help them in that way. And that you donate time and resources, if you're able to do so, to a lot of faith communities provide respite events. A lot of civic organizations will have like one-off respite events, and things like Parents' Night Out and that kind of thing are also a form of respite for caregivers. And so if you have a faith community when they fully reopen, and it's safe to do so, you might think about those type of things, like what could our organization do to promote events like that, and provide information to medical providers. And that includes whenever you go to the doctor, say, I'm a caregiver if you are, or provide them information about what respite is, and encourage them to have the respite conversation with caregivers they serve. It's 25% of people who are coming through their doors, and then oftentimes if it's not their patient, then it's the caregiver of their patient. And so there's plenty of opportunities for them to consider respite as something that they refer to and encourage. And then advocate for all of the needs of family caregivers, and to make sure that they're able to sustain work and have benefits and policies that support them, and refer people to services. Participate in Respite Awareness Day, and this is a time that we come together to thank legislators in our state for funding respite services in South Carolina, and encourage the continued funding and full funding of that in the state budget, and also encourage them to understand the stories of caregiving, and we have family caregivers come and share their stories and what is important to them as a caregiver, and share about the needs of their care receivers. And we do that in February of every year, and upcoming in February 2021, it'll also include a virtual component if it's not able to be in person. So that's always something that we welcome everyone to attend. And then also consider joining regional advisory councils. We just started the one in the PD, but we have them across the state. We have one in the upstate, we have one in the low country, and within the next year or so, we plan to start one in the Lower Savannah area. And then join our information dissemination network. So you can contact us at info@screspitecoalition.org, and we'll add you to our newsletter that comes out periodically. And we also send out policy updates and general respite updates as they become available. So I'm a social worker, and I used to work in research, and it's important for me that I always cite my resources. So there's an article that has good data in it, and then feel free to contact me with any questions you might have, or if there's anything that we can help you with, or if you need referrals anywhere, we're happy to do so. I'm also happy to discuss respite and caregiver training, or how to train and hire care providers for any social organizations that you might be available or involved in. We'd be happy to do so. So thank you for your time today.
Thank you.
Thank you.
Thank you. That was most helpful.
Thank you. Thank you for attending.
Absolutely.
So do you have any questions?
Yes, this is Rita. I'm in Lancaster County, and I'm wondering, are your the respite folks, are they volunteers?
So we don't actually send direct providers. So we do training. So if a family gets a respite voucher and they want to hire someone, then they would select and hire someone independently, and we would reimburse them for it. But we would teach the family caregiver how to find someone, how to train someone, and how to be their household employer. And then, you know, we do have a program with what we call break rooms, and we're working with 5 churches around South Carolina. They're all closed right now, but we're working with 5 churches around South Carolina that have respite rooms during church services so that caregivers can come and participate in events at their church while their care receiver receives care, and that is run through volunteers. And we also have trainings available to families and then also other community members about how to become a training, or how to become a respite care provider, and what skills are needed, and some sort of workforce development topics. And we'll be continuing to develop those virtually in the future.
That's wonderful. I personally had been a volunteer with hospice, and we provided respite, and that was very rewarding. My job has become too intense right now to continue, but that was an honor. They trained us, and they trained us to do catheters. That was beyond my scope. So, I mean, I'd be more comfortable with a medical person who did that. But I love this idea. And being a library director, I am so glad that you're there, because if we come into all kinds of situations and patrons who are burdened in ways that you never know. Somebody might break down and say, I'm exhausted.
Absolutely.
And it's so good to know you're there.
Yeah, we're happy. I think what we always try to reinforce that sometimes the best thing we can do to support caregivers is just listen to the fact that their lives are very demanding, and just being there for them. So I thank you for providing that service to them too.
Thank you so much. I've enjoyed this thoroughly.
Thank you.
Take care.
Very useful information. I know in a lot of libraries we have not only the caregivers who are looking for places to be, but also often, you know, their care receivers, their kids or family members who need activities outside the house.
Absolutely.
So
yeah.
We see a lot of people.
So you can think about ways that state libraries, you know, and libraries throughout South Carolina are also providing respite in a way. You're an informal respite provider.
We see so many people with a variety of needs and so many different circumstances and situations.
Absolutely.
Well, I'm delighted to know you're there.
Thank you. I hope you have a great day.
You too. God bless.
Thank you.
Bye.
Bye.
Excellent information. I'll go ahead and stop the recording here.
Thank you.